Alliance for the Brave, a program that advocates for our active military, veterans, and first responders. Presented by Gear Services Web Design. Alliance for the Brave, serving and empowering those who serve our great country in the line of duty. Tune in, join in, and plug in with us around the globe. Welcome to Alliance for the Brave.
In the air everywhere across America, you're listening to Alliance for the Brave, where we bring education, information, and communication to today's veterans, active duty military, first responders. And boy, we just pray for them and our absolutely wonderful patriots who support all of us. I'm Jim Blythe, U.S. Navy veteran. Joining me, my co-host and partner, one of my closest friends, London Mason. Good morning.
Good morning, Jim. How are you doing this fine morning?
I am fantastic. Beautiful day in the neighborhood.
Yeah.
And while we shouldn't date the program, this is Texas-Oklahoma weekend.
Hey, I got a question for you.
Yes.
You're a Navy guy.
Yes.
So did you drive the boat or did you just ride?
No,
what did you
I
do?
rode, Betty.
You was riding?
Quartermaster. As a matter of fact, I was on aircraft carriers, but I did get a chance, thanks to some wonderful people in my squadron VA 163 to qualify and fly in the back
Well,
seat.
look, I got one more question for you before we move forward. Is there an actual cockpit in a boat?
The bridge? Are
Like,
you
do
kidding?
they drive it? Who drives it?
Yes, there is a bridge on the ship, and many ships actually have a secondary steering down in the aft portion of the ship that you can't see.
All right, yeah. So we'll chat about that later.
But one of my closest friends in college was a quartermaster who was on board the Enterprise when she did sea trials in 1961 and 62, and he was at the helm. And they did a speed run with nothing on it, and he said, I can't tell you what the speed was, but we had a rooster tail, and you could have water skied behind the Enterprise. Can you imagine?
Yes.
1,100 feet
yes and
long,
no.
205 feet wide.
That is crazy.
All right, let's get down to the real stuff. We have basically a broadcast partner. I think he's now a member of the team.
Yes, he is. He doesn't know it yet.
Yeah.
He doesn't
But
know it yet.
representing the great United States Air Force AIM High Director, Dr. Stephen Holt of the North Texas VA Healthcare System. Steve, welcome aboard,
Welcome,
brother.
sir.
Good morning, folks, and good morning to all the listeners.
Dr. Holt, your background, you are a medical doctor, you are an administrator, and most of all, you are an unbelievable servant of our veterans. One of the most important things we've talked about, you and I have talked about, is the importance of COVID. And let's focus in on that right now, because we want people to know the importance of getting that shot.
Right. So, even though we're seeing the numbers starting to taper off, I'm going to say just in my hospital alone, which is the second largest VA hospital in the country, I still have 8 to 10 times as many people in the hospital with COVID as I did as our lowest points last summer when we were in between peaks. Now, I cannot emphasize enough that probably unless you stay home and you don't interact with people, the single most important thing you can do to protect yourself, your loved ones, and others is to get vaccinated. These vaccines have proven to be among the most effective vaccines we've ever produced in the history of medicine. They work very well. The risk of side effects is incredibly low, very low. And at this time, because we were also gearing up for flu season, you can get your COVID vaccine and your flu shot at the same time. And also, if you're due for other vaccines, many of those can be administered at the same time as well. So things like the varicella vaccine for not chickenpox, but shingles, the adult version of chickenpox, and your tetanus, which many of us are behind in tetanus that you should get every 10 years, and many that are the age of the folks sitting in the studio today may be behind in that.
I resemble that remark.
So, it's absolutely critical. I mean, we look at first for your own protection. Second is to protect others. And what is
Keep going.
your societal obligation to help protect others? I mean, this is a very simple thing, very reasonable, and only really a few minutes of discomfort for the large majority of people. I can't emphasize the importance enough, and no one wants a loved one to die because they brought COVID home and gave it to them.
Dr. Holt, you commented when you came into the studio today that I'm wearing a suit, a coat and tie. I'm going to a funeral right after this for a good friend of ours who didn't believe in, as best I understand it, did not get the vaccination. He went to his hometown to take care of his parents. They had it. His father passed away, and he passed away as a result of getting COVID. My cousin and I grew up together. We're both only children, and so we were like brothers, and we hunted together, fished together all our lives. He lived on 200 acres south of San Antonio. They pretty much isolated. He came down with it. I talked to him, and I said, how are you doing? He said, I got a bad cold. I just can't get rid of it. Then they thought, okay, you got pneumonia. They took him to the hospital. He was just gone a couple of days later. He had COVID. This stuff hits so hard and so fast. My cousin had underlying conditions of asthma. I don't know what the other gentleman, what underlying conditions, but one of the things that we're seeing is underlying conditions. And you and I talked about this. Maybe a genetic predisposition, maybe something you've already gotten, but this thing affects everybody differently. And just because you know people who came through it and said, oh, it's no worse than a bad cold, that isn't always true, is it, sir?
No, it's not. And so a very dear friend of the two of us, who I won't name, but his brother got COVID and basically died within about 24, 36 hours later. He later got COVID and developed long COVID, which is, kind of severe memory and functioning and whatnot, and basically had to retire. And he was a very high-level executive person. And I guess I'm going to deviate for a second and say, if I told you I have a vaccine that could prevent you from getting Alzheimer's, would you be interested in taking it?
Yes.
How fast?
Yeah.
Well, yeah, exactly. So the long COVID, we call it, the people who have continued sequelae, effects of COVID months, years later, like memory, organization, the ability to think, those kind of things, is essentially, it's not Alzheimer's, but it has the same symptomatology and impact. So I have a vaccine that can prevent you from getting that. So I asked yourself the question, if you knew you could prevent Alzheimer's by getting a shot, would you do it?
Oh,
well,
absolutely.
And your odds of getting Alzheimer's are probably, I don't know the numbers, but probably along the same line as dying from COVID.
Yeah. But just interesting enough, Dr. Holt, that you say that like that. It's just concerning, I guess, to most, that if it was a shot for anything, cancer, Alzheimer's, whatever it is, we know that those are severe diseases or what have you. But then when it comes to this, it's like it's just something that, well, no, it's okay.
Yeah, the thinking is different, and that's we as people do that. That's there's some great books that have been written on things like Predictably Irrational is a title that looks at how we think and how we think irrationally around certain things. So the argument really is, how safe do you want to be?
Yeah.
How safe do you want the people around you to be? And do you want to potentially have been the person who transmitted the disease down the line that someone else died from?
Yeah.
Wow, I think that's important. And so to the folks out there, and I understand maybe your reluctance that you think that this is not a good thing, taking the vaccine. You don't want to be forced to take the vaccine. I mean, my goodness, we live in Texas. You talk about an independent bunch of cowboys. We are. And that's a good thing, except when you're talking about putting your emotional thing in front of a health thing. A health attitude. And that's why I asked Dr. Holt to come in today to talk about this and the severity of this. Where are we now kind of in this pandemic nationwide?
Right. So we're seeing the second major wave. The first really big wave was in the January to March timeframe of this year. And now we're seeing the second major wave is curving off. And the second wave, we got to about 75% as many cases as we did in January, February. Now remember, January, February, March, we were just starting to do the vaccine. Now we have about, in Texas, 58% of the population has been vaccinated, which is far from the 70 to 80% we'd like to see. But even with that level of vaccination, we got about 75% as many cases with the protection because so many people were not vaccinated. Now, the good news is so many were, and as I said, we're coming down the slope, but still the disease is very active across the country. And I'm just looking at a map, and I'm sorry we can't show this to the people on the podcast, but the hot areas that remain in the country are Texas, the West, Montana, Wyoming, Idaho, in the East, Kentucky, West Virginia, Georgia, South Carolina. These are the hottest areas in the country still for COVID as of 2 days ago, based on the data I'm looking at. So, wow.
We a quick kind of pause here for a second as I take a deep breath because, like I say, I have been affected. My family. I know a lot of people who haven't been affected, but I'm beginning to find many more who have been affected. Yeah. So this is important. So first of all, go get the vaccine. Go get it. Go get your booster shot. I did it. I did the Pfizer. It didn't hurt. If I told you the joke I said to the lady who gave me the shot, I think I'd lose my airtime. But I'm just telling you guys, it ain't a bad deal at all. No. But dying of COVID, giving somebody else COVID, or some of the after effects. Dr. Holt, we talked about the memory, Alzheimer's and memory, and how they're seeing this being an effect. What are there some other effects that we've seen that we don't understand?
Yeah, there's effects on the heart and the kidneys that can also occur with what they call the long COVID syndrome. And it's most pronounced with the neurologic symptoms, the memory, the ability to function. That's because that's most obvious. If you have effects on your heart, we may not see it unless you're sick enough to end up being admitted to the hospital. So a 10% reduction or 15% reduction in heart capacity, cardiac capacity, you may not, you'll notice it, but not enough to think there's something wrong. I guess.
Now, when you talked about kidneys, is it like what opioids will do, that they'll destroy your kidneys? I know I've got some kidney function as a result of that. Will they cause other things, or do we know yet?
We don't know yet. We're just starting to do studies. I mean, this is like Gulf War syndrome. It took us years to tease out a lot of this. It's like the Lou Gehrig's diseases, ALS, that came out of Kelly Air Force Base exposures. It took many, many years to piece this together. Agent Orange, another example. We wish we could piece this together quickly, but many of these things take years to study and look at and figure out. But what we do know is that this virus causes blood clots, and particularly blood clots in the smaller blood vessels. So you're less likely to have a blood clot that just causes you to have to go to the hospital right now, and more likely, like I said, to have that gradual decline that you adapt to. You just don't quite notice until you suddenly say, 2 months ago, I could climb 4 flights of stairs, okay, and now I'm out of wind when I climb 1.
Man, you mentioned blood clots. Now, I've had friends of mine, I've had people I know quite well who've had major strokes. That's the number one cause, isn't it, Dr. Holt?
It is. And again, what happens with a blood clot in a vessel versus what you get when you have a wound on your skin is it blocks the blood flow downstream. And the tissues downstream, unless you're very fit and you have a lot of collateral, and I mean very fit, like you're running a couple miles a day, there isn't that collateral circulation, so the tissue downstream dies. And many of those tissues are not capable of reproducing. Brain tissue doesn't reproduce. Kidney tissue doesn't do that.
All right, we're having a very deep discussion, a very important discussion. And if you don't believe that the COVID vaccine or the COVID is for real, wake up. Smell the roses, because you're liable to be smelling them at a funeral, or you're liable to not be smelling them at your own. So we want to encourage everybody, and if you're a veteran, if you're one of my age group veterans, we're Vietnam, you really need to get this. So this is important. We're going to be continuing the conversation with Dr. Holt, not only about COVID, but about our VA and how important that is. So this is Jim Blank in London Mason with Dr. Stephen Holt, better known as Steve, the director of the North Texas VA. This is your Alliance for the Brave with education today for you.
thing has beaten every war we've ever had.
The other thing about this, and when you said that, it just occurred to me, in 1912, I believe, there was an epidemic of the flu, the Spanish flu, that supposedly killed a lot of people.
Rotate around the.
Like
when
this?
You look at him.
Oh, I got you.
Distance,
I got you.
that's
Okay.
Yeah.
what's hurting us, okay?
I'm sorry.
But you're doing great when you're in the right range.
Okay.
There we go. Had to tilt the neck up.
All right.
Okay, good.
Oh, okay.
Do you have any idea of that epidemic that happened in, what, 1912, 1918, I think?
Oh, the Spanish flu?
Yes, sir.
The 1917, 18, 19. Yeah. Which actually had a significant thing to the World War I ending because people couldn't field enough young, healthy people.
Really?
Yeah. So if you can't field the armies,
What do you do?
exactly. And
Yeah.
you know, we know, for instance, one of the things I learned in medical school, because I went to armed school forces, China was preparing to invade Taiwan back in the 50s. And they knew that they didn't have the landing craft to get them out actually on the beach, so they were going to have to swim some distance. And so they were training to swim, and they trained to swim in a portion of the Yalu River that was heavily infested with schistosomiasis. 500,000 cases of schistosomiasis. Invasion put off indefinitely.
Wow.
Ooh-wee.
So,
Hey, when you say, now we're live on Facebook, so maybe we should bring that up.
yeah.
Okay. And Facebook, this is Dr. Steve Holt, who is the director of our VA North Texas. You know, one of the things that I was talking with Ken Watterson about, who is the head, he said, and this was before you got started, he said, do you know who Dr. Stephen Holt is? And I said, no. He said, he was here before, and he went up to Chicago and straightened out a VA that was in a terrible mess up there. He said, we begged and pleaded when Jeff Milligan moved to get Dr. Holt to come down here because he's the best. That came from Ken Watterson, and he would know. And so I just want you to acknowledge, or I want to acknowledge to you, what a great job you've done here. Yeah. And then getting this VA hospital in Garland. Yeah. Steve, that was unbelievable. That's smart.
Huge. Yeah, I'm actually getting. I did my transfer because I was coming from Austin, of course, and working at the VA there. So now I'm here, and the amazing thing about the Garland VA was I was like, man, I was here a few years ago when it was I think it was Baylor or something like that.
Baylor, Scott and White.
And I used to visit clients there doing peer support, but now it's a VA, and yeah, you've done a tremendous job with that.
So, and again, I have a great team. There's absolutely no substitute for having a great team, or you can't do anything, okay? Yeah. And to quote a former chief of staff of the Air Force, a mentor of mine, there comes a point in your life where almost everything you do, you get done through others. And,
yeah.
I'm obviously at that point of life. But one of the things that I think enable us is we're not waiting to be rescued. I can't wait for central office.
Yeah.
You're listening to Alliance for the Brave, honoring, serving, and empowering those who serve our great country in the line of duty. Today's program is presented by Gear Services Web Design. Learn more about our mission and how you can plug in with us at allianceforthebrave.com. Now, back to the conversation.
Well, welcome back. On this beautiful day, I've got the great honor to have Dr. Stephen Holt, the head of the VA here. I'm so thrilled, but, you know, we're going to be able to watch the traffic coming down from Oklahoma, Dr. Holt, and they're headed to the Cotton Bowl. So somebody the other day said, Jim, you went to the University of Texas. And I go, that's right. But I was in the Navy, so I root for Navy because everybody beats us. But he said, well, who are you going to root for, Texas or Oklahoma? And I said, the city of Dallas. That's the big winner in this deal. All right, let's go back talking about COVID and how important it is to get a vaccination. You got to go. You got to do it. Just like when we went through those long lines and they took those air guns and shot us full of vaccines, I think I got every imaginable vaccine in the world. But you're talking about a couple of other things. We were also talking about the effects of this. Back in 1918 and the Spanish flu, you said that impacted the ability to have people because it killed so many people back then.
Right, and that flu was interesting in that it really affected young people. And what it did, it had such a high mortality rate with it that it became difficult for the militaries to find enough young, able-bodied men to fill the ranks. And it had a great impact on bringing World War I to a close earlier than it may have occurred because the militaries couldn't field enough people. And certainly Germany couldn't field enough people when the U.S. weighed into the fight. But again, we brought that back to Fort Devens up in Massachusetts was the first outbreak we had in this country. And it's
Really?
Quickly, yeah.
And that's how it came from Europe.
That came from Europe.
Wow. So what we're faced with in this, now we're beginning to see this is such a global colony that we live on when you think about it, that somebody in Spain could end up causing something that caused how many hundreds of thousands of lives?
It was,
maybe?
I want to say it was, I can't remember how many hundreds of thousands we had in the U.S., but worldwide it was about 4 million people had died from this.
Okay, but right now, today, you also made a point, Steve, that 700,000
Right.
have died of COVID in the United States.
So think about this. Let's put that into perspective. That is more people have died from this eeny beeny little slight viral particle than all died in our most bloodiest American conflicts.
Wow.
Conflicts where people went out with the intention of killing each other.
Yeah.
Okay? More people have died, more Americans have died from COVID in less time, by the way, because remember, we're not even 2 years into this thing,
Yeah.
than died in our bloodiest conflicts, which if I recall correctly, was the Civil War.
Yeah, there was somewhere in the neighborhood of over 600,000 that died, but it took 4 years for that to happen.
Yeah.
And that wasn't a disease, although there were diseases that came out, I think, during that time. Malaria was a big one that affected people. This is what we're talking about, taking care of your health. What London and I always preach is if you're a veteran and you're qualified, go to the VA.
Yeah.
If you're not, get health insurance. Get with a doctor. Get your vaccinations. We're talking about not only COVID, we're talking about flu. You also mentioned shingles.
Yeah, shingles is I mean, if you want to have a chronic pain syndrome forever, get shingles. Have shingles. And shingles is basically a reactivation of the virus that causes chickenpox in children. It lays dormant in the nerve cells and reactivates when you get much older and your immunity is not as strong to it. And it causes basically a line or multiple lines coming from your back across to your chest or in your legs. And unfortunately, it affects the nerves in such a way as to cause chronic, unrelenting pain. So if you want a chronic, unrelenting pain syndrome, get the shingles. If you want to prevent it, get the varicella vaccine or the shingles vaccine, which is a 2-shot series. I've had it, so I'm a personal customer of the thing, and I strongly recommend that you get it.
Yeah.
All right, tetanus.
Dr. Holt. Oh, I'm sorry.
Yeah.
But Dr. Holt, real quick, what is the policy now in terms of the VA with I know the whole country is doing the booster shot, things of that nature. What's the policy now, if any, for the VA?
Right. So there are two things. That third shot goes under two different thoughts or two different processes.
All right, tell you what let's do. Let's bring this conversation back in just a second. We're going to hear from all of our partners. It's important. What is going to be talked about is the importance of the vaccine, the importance of the shots, importance of other vaccines, tetanus, typhoid. We're going to talk about all of those when we come back. This is Alliance for the Brave, and I'm Jim Blythe with London Mason with our great guest, Dr. Stephen Holt, Director of the VA North Texas.
Because I was asking about what's the new policy now? Because I did see a few things coming in through email, but what's the information on that?
The information is that if we're recommending a third shot, we're actually requiring it. Well, we're recommending it for healthcare workers.
Yeah.
A third shot, at least I want to say 6 weeks after the second shot. We're recommending it for people who are at high to moderate risk, so people over the age of 60, 65 who have, and or people who have diabetes, heart disease, pulmonary disease like chronic obstructive pulmonary disease, those things. And there's a list on the CDC website that gives that. We're recommending those people get a booster shot, or in the case of some, we called it a third shot. We consider the primary series requiring 3 if you're immunocompromised to get a good immune. Everybody else will call it booster. It's kind of irrelevant now.
Yeah.
It's just called a third shot,
Yeah.
the way things have evolved.
Right.
So,
And I can remember that, like everybody took the COVID. I took the Moderna, but you had to wait that 15 minutes or so. Is that same with the booster too?
yeah, the same. And the 15 minutes is just in case you have a reaction to
Yeah.
the shot. And the odds of that are very low with Pfizer and Moderna because of the way they're created. Perhaps a little higher with the Johnson & Johnson single-shot vaccine. And right now, the Pfizer and Moderna are the two that are recommending a third shot. Now, they haven't come out with a recommendation yet for the single-shot J&J, whether you should have a booster or not. Although I
Right.
believe Johnson & Johnson has put in data to have the CDC consider that.
Yeah. Jim, you had something earlier.
Well, I think it's important that you don't just look at one thing of COVID, and I keep coming back to this. We got to look at COVID. We got to look at flu shots because we talked about the Spanish flu in 1918. You got to talk about shingles shots because that's chronic pain. And many of my listeners are my age or Vietnam veterans. Many people have basically some compromised immune system from any number of things. Now, one of the things is I was down at the VA years ago and talking with Jeff Milligan and commented on the number of people I saw in wheelchairs. And I said, gosh, the combat amputees. He said, it's not combat, it's diabetes. That's something that really has to be handled. And I know you told me that the VA really has some great programs, preparations, things to help people who are diabetics and keep them healthy. I think this is incredibly important because diabetes, that's not always just a genetic disease that you get. You can get it by being overweight and screwing up your own life with that, correct? Yeah.
Absolutely. And yes, absolutely. You said it perfectly.
What?
I was going to add, I don't know. Well, yeah.
The sailor did that? Hey.
Dr. Blythe.
No. Although my handwriting is so bad that they said I could have done that. I said, well, I don't think I would really want to go there. Although I did want to be a medic when I first joined the Navy, and they said, no, you don't. And I said, well, why not? I want to help people and save people. They said, no, you don't. I said, why not? I said, front lines of Vietnam with a great big target on your chest. I said, have you got anything in naval aviation?
So I have a quiz for you.
Yes, sir.
Navy, and I'd studied a lot of Navy because of my last job, right? Mm-hmm. So what career field in the Navy has the greatest number of Medal of Honor winners?
Oh.
I would probably say bosun mates or quartermasters. Here we go.
Today's program is brought to you by Gear Services Web Design. Visit us on Facebook or online at allianceforthebrave.com. And now back to Alliance for the Brave.
Yes, we're back now with Dr. Holt and my awesome host here, Jim Blythe, and we are just having a great conversation here about COVID, the vaccines, and everything that you guys will need to know, information to how to get the vaccine, the importance of it. So Dr. Holt, just kind of continue to share with us some more information about what you know in terms of what the general population needs to do.
Yeah, so I'm going to tell a little story as I lead into that, okay? So I didn't know this. I was reading an article about 2 weeks ago that one of the first mandatory vaccination programs was actually carried out by General George Washington. Wow. Because he had an outbreak of smallpox, and we knew at the time that by vaccinating people with the cowpox vaccine, he gave them immunity. So he had an outbreak in the Army when he was up on the roads, and he mandated that everybody get vaccinated. And that probably saved the Army because there was a 10% death rate with smallpox alone, very transmittable. So back to vaccines. Vaccines are one of the most effective things. If you look at the history of health and public health in our country, vaccines, public sanitation, antibiotics era, and then modern medicine with things like anesthesia, so we could do advanced surgeries. Vaccines are very effective. Measles, mumps, and rubella, how many times do you see that? Because we require those immunizations to get in school. How many cases do you see of measles, mumps, and rubella? Serious diseases that cause mental retardation, and a significant number of people have got them. Mumps, you get that over the age of 8, you have a high chance of being sterile because it affects the testicles. Okay?
Really?
Yeah. So these are very effective. Pertussis, another one. Kids die of pertussis. We don't see deaths of pertussis except for the unimmunized. So turning to adult immunizations, tetanus is a very important one to be up to date every 10 years. Most of us don't get tetanus after we go to high school or college because it's not a requirement unless you were in the military. And so we see the waxing of that immunity, and tetanus is another lethal disease, by the way, around age 40, 45. So I really urge you, if you haven't had your tetanus, if you can't remember when you had your tetanus, get your tetanus shot. Because as we get more mature, we like to start doing things we didn't have the time to do, like woodwork and stuff, and we're likely to get cuts and infected wounds that would result in tetany. So these immunizations, this whole schedule, you go to the American College of Physicians, ACP website, and they can tell you what immunizations you should have by age there. The CDC also has that. You can go to their website. But I really urge you to be up to date. These vaccinations are just short of miraculous in terms of preventing these very serious diseases and the disability that comes with them.
Well, I got to remember, as a child, going through the line and getting a sugar cube with the Salk polio vaccine. When I was a child, polio was a huge, huge problem. And Dr. Salk came out with the vaccine. I remember you got a vaccination, then I think a year or so later you got it again. And there they gave it in a little sugar cube, in a little cup. They handed it to you. So you didn't get a shot. But with that, it stopped. It stopped polio. And a lot of people say to me, what is polio? It was a horrific disease that crippled people. And if there was one, there was hundreds of children who ended up in an iron lung because they couldn't breathe. Remember Dr. Holt?
Yep.
It was horrible. And it got stopped thanks to the Salk vaccine.
Yeah.
And that's a fascinating story because not only it stopped, that was a live virus, attenuated, meaning we run it so it's no longer harmful. That virus essentially almost eliminated wild polio. It took over, because you would shed it and people would drink it in the water. You'd shed it through your bowel, and water that wasn't properly sterilized that people would drink back in that age. And it spread by secondary vaccination, we call it. But it essentially replaced the wild strain in almost the entire world. So we've actually gotten, think about some of the things we've cured, okay? Smallpox. It doesn't exist. It only exists in 2 laboratories, one in the U.S., one in Russia. There is no smallpox out there. We haven't seen a case in probably over 40 years because of that strong eradication program. So we can beat these diseases.
Yeah. And this is important. So wake up. Be a part of it. Get the vaccinations you need. Not just COVID. Get flu. Because we're going to have a terrible flu this year. I firmly believe that this is going to be, because I've heard 3 doctors tell me, hey, get your flu shot. Because why they seem to think this is going to be a bad situation this year in flu, I don't know. But boy, let me tell you something. Maybe because so many people got the COVID shot and didn't get a flu shot. And there's other things that you've got to take a look at.
Yeah, and some of that is we had such a mild flu season last year because everything we were doing for COVID helped reduce the spread of the flu. But so much of the mask wearing and other things that were effective have kind of fallen by the wayside in so many areas. So, and even, we look at it, if you're vaccinated, you don't need to wear a mask going into places. Well, you still can transmit the flu, though, if you get it.
Yeah. Now, Dr. Holt, could I change the subject a little bit, please, and talk about careers? You have had an incredible career of service with the Air Force. You ended up being a bird colonel, retiring from the Air Force as a medic. You had a tremendous career that you're still a director and very much involved in the VA. This is a wonderful position. This is a wonderful profession. Could you talk just a little bit about that, but about the opportunities for employment? Because you have, what, 6,000 people that work for you in the Dallas-Fort Worth area?
Yeah, 6,400 actually. And that number will probably grow by a couple hundred this fiscal year as well. So I've been blessed that people gave me opportunities. And one of my mentors told me, very important, never say no. And so I've been blessed that I was given opportunities. I had teams that were highly effective and able to get things done. And I think that's the uniqueness of the military. As you know, we have a motto, a ethos, get the job done. And we don't wait to be rescued. You know, we figure out what we need to do, and if rescue comes, well, that's nice. But we don't wait around going, well, we can't. And so I've had that. I was trained that way. I was brought up that way in the military. Had some very, very good mentors who took the time to set me straight and give me the opportunities to serve. And I'm going to say service is where it's at. And if you look at all the major religions in the world, et cetera, and what constitutes a fulfilling life, a central theme in all of them is service to others. And so I've been blessed to serve the military, their dependents, and the veterans all of my adult life, with the exception of about a year and a half that I was involved with a private community hospital out in Colorado.
That's quite a thing. So if somebody wants to go to work for the VA, if somebody is coming out of college or whatever and they want to go, where do they go to look? They go on the VA website? Is there an employment deal there?
Actually go to USA Jobs, USAJOBS.gov. That's USAJOBS.gov. And all the jobs are posted there. Now, we do have some authorities for certain medical folks like doctors, nurses, and certain clerk positions to what we call direct hire authority. You don't have to go through that process. But establish a USA Jobs account, get your resume loaded there so you're ready, and when you see the jobs that you're interested in, you can set up searches, apply for those. The VA is a great place to work, as is most federal agencies, because you have tremendous number of protections built in by law. The personnel system gives you a lot of protection in terms of your job. You also have great benefits because they have, you know, for instance, a matching thrift savings plan, which is like a 401k, the government version, where they match your contributions up to 5% of your salary. They pay about 75% of your health insurance. They have a good premiums on life insurance. You get, depending on what where you enter and the type of entry, you get up to 26 days paid leave a year and 13 sick days in addition to what I think is now 12 federal holidays with Juneteenth. I think we now have 12.
Woo-hoo.
So that's all
Yeah.
paid time off that you earn as a employee of the VA. They vest you at 1% a year times the average of your high three once you reach the appropriate retirement age, depending on your age and when you entered and stuff. So say you put 30 years in the VA and you max out, I'll pick a number, 100,000 is your high three, you're going to get $30,000 a year retirement in addition to what you saved in TSP and in addition to Social Security.
Yeah,
Wow.
that's one of the things that I didn't realize. You were active duty. I was active duty military. I know we paid into Social Security because I went back and looked at it.
Yeah.
So if you're active duty military or you're military, your pay has also got the Social Security deductions. So you, for instance, London, when you turn 67, 68, and you're only, what, 53, 54 now?
I'm 49.
Okay.
Yeah. I don't know what's the deal with this Navy guy.
Okay, so
Hit me with
you get an Army retirement.
Yes, sir.
You came out as an E7, correct?
Yes.
You get then Social Security, and you be probably at the top end of the Social
Yeah, by
Security
that time, yeah.
scale. So you've got two pensions right there. Now you also are working with the VA now.
Working for the VA, and I also have VA disability for the injuries that I sustained. So yeah, it's quite it's interesting because I've known so many people that have, left the military service, especially retiring, and having all of those benefits, and you can just live off those benefits.
Well, let me
know.
tell you something.
So it's a great thing.
Yeah, as a certified senior advisor, 95% of the people in this nation have nothing but Social Security and maybe a home. You know that? 95%. You know what the average Social Security payment is in the United States, guys?
Probably about 1,000.
1,400.
Wow.
That's the average.
Yeah.
In many cases, what I see is a husband who has maybe $2,000 a month and a wife who has $1,000 a month, and when one of them passes away, they lose that lesser of the two income.
Yeah.
But with your VA, with your Army, you can have your wife designated as a beneficiary, correct?
Yeah.
Yep. 55% of your annuity.
Yeah.
To your spouse.
Yeah. So you've got protection built in for your family as well that you may not have in the private sector.
Yeah.
And especially if you're self-employed. What I see, a lot of people come to me and go, Jimmy, can you help me out? Because I was self-employed. I hardly paid anything in.
Yeah.
I got $700 a month Social Security. Do you have any idea how frightening that is? To face the world in reality with that? I deal with that every day.
Yeah. Well, you know what, Jim? It's just the hurting thing is not having information. You know, any of us, when we left the service, no one gave us information. But when now in modern day, when you have so many entities that can give you information and no one wants to really get it or not really understand it, that's where the tragedy is, to where the benefits that you're saying.
Yeah.
You know?
What were you, Steve?
So let me pipe in here and say a couple things. A very, very important group, and if you're going to put in a VA claim, is those veteran service organizations. They have people, certified claims people. Now, I can't advocate for you as a VA employee. It's called a conflict of interest to say this is what you apply for. But they do this, and they're very good. And I told the story the last time I was on of how I did my claim myself the first time, and it came out way less because I just had another claim put in recently by a VSO who got a much higher percentage of military-related issues than I did, being a physician, et cetera, et cetera. So they're very good.
Physician, heal thyself.
Yeah, so it's really important that you connect with, you know, these veteran service organizations like the American Legion, the Veterans of Foreign Wars, et cetera. Go ahead.
You know, here in Texas, every county that has a population greater of 125 has a veteran service officer, a county veteran service officer that is paid by the Texas Veterans Commission. As a result, as I understand it, and correct me if I'm wrong, they have access to all the records in their computer system.
Yep.
So they can go back and help you get things that you may not be able to get.
Yeah.
And so many people just don't realize what they could be eligible for. And I'm going to say they just expanded the eligibility for people who served in Southwest Asia, Iraq, Afghanistan, et cetera, around pulmonary diseases like chronic sinusitis. I just saw this message come out earlier this week.
Well, guys, let me tell you real quick. We had a listener call in from Richmond, Virginia. We got them hooked up with an American Legion accredited rep. The net result is he was a World War II veteran, able to get the aid and attendance benefit, which was about $2,300 a month, then got his wife to be beneficiary of that, made all the difference in the world. You need to check it out. You need to go get with a VSO, as Dr. Holt said. So here's what we're going to do. We're going to be right back to wrap this up. After these words from all of our partners, this is Jim Blythe in London Mason with Dr. Stephen Holt, the director of the North Texas VA. If you got questions, send me an email. I'll be able to do my best to get you a good answer because he's got a great team. This is Alliance for the Brave, and Dr. Holt is on our team, bringing you this kind of education.
Garland VA, is that considered a CBOC?
No, yeah, it is right now.
Yeah.
We're continuing the exploration of turning it into a full-bedded facility.
Yeah.
And great community support there, obviously. Jim obviously is helping us too in a variety of ways because he's looking to see, can we put a Veterans Resource Center over there, which would be...
That'd be great.
Really
awesome.
great.
Guys, I got so excited that we had a tour this week with a construction contractor who's also the vice commander of VFW in the state of Texas. And we went through there, and I looked at it with fresh eyes, with Lynn with me, and holy cow, we began to see where these offices could be used as classrooms and where there was setups to where computers could be set up in cubicles to work with people. That thing has got a great setup, and there's a great big huge area that probably was a warehouse that we can turn into an auditorium. Lynn and I got so excited as we went through there, and we're now putting together the budget. I got a phone call the next day from the head of economic development for the city of Garland. And I met with the head of the chamber, and I met with that lady. And I got to tell you, the city of Garland is like, what can we do to partner with you and help you? What can we do to bring this kind of job placement, education, certifications? And it's all going to be under the VA's, I guess you would say, umbrella, because we're going to be there right there on that campus, not in the hospital. You don't have to go into the hospital to get there, but we're going to be right there providing education, certifications, and employment. And I am so excited.
That's awesome.
Yeah, and then we're going to have to find somebody to run it because I ain't got.
Well, maybe I'll retire.
I got to tell you, if and when you retire, I've got some things I want you to. You're going to get involved with us in what we do, because I got to tell you, I think there's a tremendous need to go across the nation, because we're in Phoenix, we're in Iowa, we're in the East Coast in Norfolk, we're in Jacksonville, we're in Reno. We need to be in more places. We're up in Sacramento. We need to be able to meet face to face and say, this is our story. Here's what you need to do. And that's one of my big dreams and goals, is to do that.
And for any of the federal lawyers who are listening, yes, I will check with the Office of General Counsel Ethics before I do anything.
That's awesome. Nice.
We don't do anything that violates anything. That's right. We are always positive and uplifting.
Yeah. And just on a side note, just for our listeners out there, if you're ever in a crisis, the Veterans Crisis Line is always available for our veterans. You know, anyone that's in a crisis.
Give that number out, the 800.
Yeah, 1-800-273-8255. And if you are a veteran, please press 1. You will be transferred to the Veterans Crisis Line. And I do want to add to that, being that I am employed, they will transfer you if there's a veteran needed to the PSOP.
You're listening to Alliance for the Brave, honoring, serving, and empowering those who serve our great country in the line of duty. Today's program is presented by Gear Services Web Design. Learn more about our mission and how you can plug in with us at allianceforthebrave.com. Now, back to the conversation.
Well, welcome back. We are so glad you're joining us today. We're wrapping this up, bringing this back into the dock with Dr. Stephen Holt, the director of the North Texas VA healthcare system, the second largest in the United States.
That's right.
6,400 people that work for you.
6,400 people, $1.8 billion.
Wow.
180,000 veterans in the area. We service about 136,000 are actually in care through us.
And not only that, but you guys do a lot of paying outside providers through the Choice Act, through those
Over
things.
$400 million a year.
All right, so what we want you to do, if you're not a veteran, then come support us, help us, take veterans, get everybody involved who can. Understand the importance of this, because the VA healthcare system has trained 70% of all of the medical professionals in the United States. Correct, Dr. Holt?
Yeah, absolutely, absolutely. And let me circle back to what we were talking about earlier for a second. If you've served and you have health problems, please go see a VSO. I had a good friend of mine who had not used a VA, who had PTSD, served in Vietnam, was also, and when he went, and he was paying like $1,200 a month for health insurance, and was beginning to have some significant health problems. He's a private contractor. He basically used to go in and flip houses. Now he just goes in and does work on houses. That qualified him for 100% disability based on the injuries and things he's had and his experiences. So he now has health care taken care of. He's not paying for that. He now has because he lives in the state of Illinois, he doesn't pay real estate taxes, which are, usually $8,000 to $20,000, very high real estate tax. And he also has a substantive pension he's getting, and one that'll transfer over to his wife when he dies.
There's so much there, and you earned it if you're a veteran, but you also, is a community member, is a patriot. We want you to support that. You can actually make donations to the VA, believe it or not. It is a government entity, but we're doing a lot, and we're going to be doing a lot more for veterans. I want to mention a couple of things coming up that are very, very important. They're really great. The Colony at their 5-star complex on November 5th and 6th is going to have a Veterans Day week with patriotic annual music festival. So why don't you go take a look at the Colony's website. This is going to be the American Heroes Festival. We're going to be talking about that with the mayor of the Colony over the next few weeks. This is an exciting thing for veterans. There are a lot of other veterans activities going on. Also, London, your Army, and I happen to know that Air Force and Navy haven't, but help our heroes. The Army Scholarship Foundation Fall Luncheon, November the 5th. Go to armyscholarshipfoundation.org. Dr. Holt, I want to close with a prayer. Lord Jesus, we are so thankful for those who have served. Guide them and protect them as they help our community and help us to grow. Protect our active duty military, protect those in the face of all kinds of dangers, whether it's military first responders or medical responders. We're so thankful for our VA. We're thankful for the people who work in the VA, and we're thankful for men like Dr. Holt who have brought so much leadership. A ship doesn't sail any better than its captain. I know that for a fact. So thank you, Jesus, for all you do for us. This we pray in Christ's name. Amen. Amen. Dr. Holt, thank you for being on board.
Thank you, sir.
Always exciting pleasure, thanks. And thanks to all the people who've served either in the military or in public service out there. Thank you.
Next week, we've got some really interesting information going to be putting out. Go to Alliance for the Brave. If you have questions, go to Alliance for the Brave. We're here to help. We're here to help you who have served America. Thank you, and good day.
Graduate on Friday, basic training.